Hi friends. Okay, I'm going to try to get part 4 done real fast before I go into work. If you didn't see parts 1, 2, and 3, go back and watch it and catch up so you can be up to date. So I will start off with, I had quite a few questions about my shirt that I wore in part 3. My Skip University shirt. So I don't know if you saw the little blurb that my sister put in part 3. It went really fast, so you might have missed it. I missed it the first time myself, but she put, "Yay Skip, my personal trainer." So that's my personal trainer. I've been working with him for over 2.5 years. That's his brand. And I'm still currently working out with him even through my health issues, just not as consistently as I used to and with lighter weights. Because as I said before in the other videos, I have scleroderma in my muscles, so it makes my muscles really weak. So I can't lift weights like I used to. So we just use lighter weights. Okay, so past that, I think we left off with my doctor put me on methotrexate once a week and to have my blood drawn once a week. So that only lasted about 2 weeks. He called my house on a Sunday, told me to stop the methotrexate. He didn't think it was working. My labs weren't looking like he wanted them to look. And he told me to come see him on Monday. So I went to see him on Monday, and he gave me a pamphlet for medication called Imurin. The good thing about my rheumatologist is he's really good about giving me info to read first and then call him with questions, and then we go from there. So he's really good about that, which I really appreciate it, instead of him just putting me on medication or making me get this procedure done or whatever. So he gave me a pamphlet on Imurin. He wants me to take that. It's twice a day, every day, and then I get my blood drawn once a month. So I read up on it. I talked to my besties and my sister, my besties, my mother and my sister, and we didn't agree that I should try that medication because the first side effect was cancer. And I looked it up on different websites. It also said this medication may cause cancer, which scared the crap out of me. So, mind you, since this whole issue started over a year ago, I literally have not missed a beat. I've done every single thing my doctor have asked me to do. Every lab test, every urine test, procedure, biopsy, everything. However, in saying that, this was the one time that I was going to actually disagree. So I did call him and tell him that I was nervous about trying this medication because the side effect is cancer. Like, that was the #1 side effect. I have scleroderma. I don't want cancer on top of that. So he said, first of all of these medications that treat scleroderma has a slightly higher risk for cancer. All of them, even the one I was on before. He said, but the question I should be asking him is not, does it cause cancer? How many people have he seen get cancer from this? So he said he's seen 3 patients total in 30 years who developed cancer with this medication. So we talked about it, and I decided to go ahead and give it a try. So I've been on Imurin now since August 11th. Today is November 14th. I've had my blood drawn once a month, like you've asked. And so far, my labs are trending down. They're looking a little bit better. He said they're not exactly where he wants them to be, but they're getting there. So it's been 3 months since I've been on this Imurin. I can't say that I feel any really difference because I've never really had any major complaints anyway. But he said it does take about 3 months for it to kick in. And really my only major complaints anyway is my muscle weakness. I can't stand being this weak. Sometimes I can't even open a water bottle. And it's really hard to carry a case of water out of Walmart. So, you know, I can't stand the muscle weakness, and my only other complaint is my hands, how they hurt every single day. They achy, they have like a burning sensation in my joints. But besides that, you know, I push through that every day. If my hands get that bad, then I'll take like ibuprofen 800 milligrams, and it takes the edge off, and I just keep it moving. So I don't really have any major complaints anyway. I feel pretty good, which is a blessing. So moving on from there, my doctor also told me, you know, these medications that treat autoimmune diseases, most of them decreases and suppresses your immune system, which makes you get sick easier. So with me being in the medical field, I'm around sick people every day, all day, and just in life in general. So I asked my doctor, my rheumatologist, can I take vitamins? I had wrote out a list of vitamins that I researched, and I asked him about the flu vaccine. So he said yes to the flu vaccine as long as it's a dead virus. I'm not allowed to have any live viruses. And he said absolutely no to the vitamins, no vitamins at all. If I want to build up my immune system, he said eat healthy, fresh vegetables and fruit, which is my only major struggle. Out of everything that I've been asked to do and told to do, I've done everything, like I said before, I haven't missed a beat. However, this whole eating healthy thing consistently, I eat healthy, I do, not consistently though like I should. So that's my only major struggle. So that was that. No vitamins, no live vaccines. Moving on from there, he had me come in and see him on November 1st for a consult to do the regular exam that he usually do. He'll like test my muscles, do like some resistance and strength exercises, and listen to my heart and lungs. And everything is so far looking pretty good. And then I told him about my hands, so he examined my hands, and they starting to contract a little bit. Like I showed you before, they don't stand up completely straight. They're kind of bent. And my index fingers really hurt. So he wanted me to see occupational therapy. So I had my first appointment with occupational therapy yesterday. She said for the first visit, she was just going to gather a bunch of information, measure my fingers, have me do some strength tests with my fingers, and then come up with a plan, come back and see her once a week for the next 2 months. And she want to try to get my full range of motion back in my hands, which is great. I hope it works. So I saw her yesterday. We had that first visit. It went really well. She gave me a couple items to make my life a little bit easier. Gave me like a red gripper to help me open up jars and open up bottled waters. A little bit easier by myself. And she gave me like this brown wrap. And she told me to wrap that around my ink pens. And the reason why she said that, I told her that the way I hold my pen, the way I've held my pen all my life, I can't hold it like that anymore. It hurts too bad. So I told her I was going to go buy fatter pens from Walmart or whatever, and then I was going to retrain myself how to hold my pen differently when I write. And then she said, well, start off with, she gave me that wrap to wrap around all my pens to make it fatter and make them softer and more comfortable. Start off with that and go get fatter pens and see if I can still continue to write and hold my pen like I always have. And if not, then go ahead and retrain myself how to hold my pen and write. This is where I stand as of November 15th. And I will make another video as I go see occupational therapy and learn new things. And I'll keep you up to date. If you have any questions, then please, please, please ask. I'll answer them to the best of my knowledge, because as I said before, I'm still learning myself. If you know any facts, then feel free to comment and let me know those as well. And I'll talk to you later, friends. Have a good day.